Hello, I'm Karen Swartz, a psychiatrist here at Johns Hopkins, and I am working with the Office of Wellbeing in our MESH collaborative. We're trying to address the mental, emotional, and spiritual health of everyone at Johns Hopkins Medicine. And today I'd like to talk a little bit about ways we can support our colleagues. I'm going to be discussing what we're facing, what many of us have taken on because of COVID, who is at risk for having more significant psychological issues, the kinds of things you might observe in someone you're working with, what you might feel yourself, and then also, importantly, what we can do to support each other. So how are people responding to this ongoing crisis? Well, I think there are three different groups. The first, and the smallest by far, are surprisingly resilient. This is a group that's really responding. They're using lots of different coping skills, and we really need to learn from that group. The largest group are understandably exhausted. This has been going on a long time, and it's just too much for too long, and people are tired. They're tired of all the ways their life has changed. They're tired of all the new responsibilities, and so they're tired. But then there's a third group, the concerningly vulnerable. This is a group perhaps who themselves had anxiety or depression before, or because they've been under more strain, or for reasons we don't completely understand, they're at higher risk of having more serious consequences. These are not groups that you're in and then you never move from. We can certainly move among these three groups, and any of us are vulnerable for becoming at a point that we need more serious care and attention. So how bad has this been? The CDC has been keeping track of this by doing pulse surveys, where they will ask a number of questions, including 2 questions about depression and 2 questions about anxiety, using standard screeners, the PHQ-2 and the GAD-2. And here, when you say someone has anxiety and depressive symptoms, that means they had a high enough score on those 2 questions to be in a range that you'd be concerned. Doesn't mean you have a depression, like major depression. It doesn't mean you have a formal anxiety disorder, but there's enough going on that you're worried. And what's striking is when they compared the results from the summer of 2019 to the summer of 2020 and the most recent results in January of 2021, you can see that the rates of anxiety and depression, or having both, has quadrupled. So this, even if all of these people are not having the kind of depression or anxiety that needs formal treatment, quadrupling of the number that are in a concerning zone is important for us to know. There was another survey that was done among 5,400 adults using these same screening methods, where they ask about anxiety and depression, but then they ask more questions about a number of other behaviors, including substance use and suicidal thoughts. They also had more information about the jobs people have as well as their age. So what we see, if you look among those having depressive symptoms, where you divide people up by their employment status, initially looking at the employed and unemployed, you'll see that it was about the same. But that didn't make a lot of sense. And so they further divide employed into essential and non-essential. So the 4 mutually exclusive categories here are essential workers, non-essential workers, unemployed, and retired. And here it's pretty clear that the essential workers are those with the highest percent reporting depressive symptoms. It's also the group that has the highest percent saying that they either started or increased substance use. So that's more concerning. And then most concerning on this survey was that over 20% of essential workers said they had considered suicide in the past 30 days. Now, these are not only medical workers, but they certainly include many people who are working here at Johns Hopkins Medicine in lots of different essential roles. There was another survey that was done in Italy specifically of healthcare workers. And they, as you know, Italy had a big challenge of a huge spike. And then they were feeling very overwhelmed and concerned about being able to provide adequate care. So they did a survey of those who had been working during that time and found that almost 50% of them had symptoms of post-traumatic stress. About a quarter had symptoms of depression. 20% with symptoms of anxiety. And then others had insomnia and also a high level of perceived stress. So feeling that you're under stress yourself. I think it's really important to note that in this survey, there were higher rates for women, higher rates for frontline healthcare workers, and higher rates among younger healthcare workers. In studies done in China, the higher rates among women was also seen, but there they were able to identify that was because nurses, who have a much more true frontline role, were more likely to be women. In this study, there were a third nurses, a third physicians, and a third other healthcare workers. So what can we do to support our colleagues? The most important thing we can do is actually make time so that we end up having conversations that are more than just a superficial, are you doing okay? If you say to someone, you're doing okay, right? You're not inviting a conversation. It's actually opening up an opportunity to speak. So you're leaning in and you're asking about how someone's doing. You're not just saying, are you okay? But you might ask, well, what are you doing to cope? You might get a good idea from someone else. What do you need? Is there something I can do to support you? What supports do you have? Can I think of others that you might be able to access? And then what might you observe? You know, we're here working with a lot of different people going through the same thing. So things you might observe with a coworker is someone being more indecisive, someone having trouble functioning at work, someone making errors because they can't really focus, having memory problems. And then I think importantly, recognizing that irritability or being more aggressive can come out of anxiety and depression. And then a hypervigilance, being really, sort of on edge, that can come from PTSD. Often you'll see that someone looks rough. They're just not put together in the professional way they usually are. And then they might be avoiding stressful work situations. Now, on first blush, that might annoy you because someone you're working with is trying to get out of taking care of the most ill patients or have the toughest assignments, but it might be that they're really feeling that they can't manage it or that they wouldn't be able to do a good job. So what might a colleague describe, or what might you experience yourself? These are much more internal experiences I'm going to talk about now. Well, of course, sadness and demoralization, low energy associated with that, having really intense anxiety that often gets worse when you're at work, not having focus and concentration. Sometimes others don't notice it, but you're having to double check things, you're having to go back and make sure that you actually signed off the medicine you gave, those kinds of things. Feeling hopeless or helpless, which is really concerning because that's when people start saying, I don't see the point of this. Lots of guilt about not doing enough. People that are doing plenty, when they get more anxious or more depressed, get a distorted sense that they're not doing enough, and they can have these very intense guilt feelings. And then also not being comfortable around others and finding interactions exhausting. So you might reach out and say, well, how are you doing? I really want to know. And the person just might not want to talk to you, or might not engage in the conversation because they're just too tired to get into it. So this is certainly a challenge, but is it also an opportunity? When we see someone who's suffering, what we can do is help make something that they feel is invisible, or maybe they don't think others are noticing, more visible. Make it something where you can connect with someone and be able to reach out and say, I've known you a long time, or I know you're not quite yourself. How can I help? When we hear someone expressing things, when we hear someone being irritable or different with patients than they normally would be, at that point, we can hear it. We should take action and be supportive in any way we can. So there are opportunities by being more attentive, being a more thoughtful listener and a better observer, where we are able to both get more support and give more support. There are a number of resources at Johns Hopkins Medicine. I think the Office of Wellbeing's website is a terrific place to start, mainly because there is this link to the supporting mental, emotional, and spiritual well-being button, where if you go to that, it will take you to all the different resources that I'm going to talk about and ways to contact them. So what do we need to do for those who are surprisingly resilient? Well, it's monitoring, learning what they're doing, and helping them keep doing it, right? So you want to prioritize time for the things that are helpful. Help someone say, you know what, I found that exercise is great, or making sure that I have meals with my family when I can, whatever it is. There are also all kinds of health programs like Healthy at Hopkins that are going to help with nutrition, with exercise, and keeping someone, with healthy habits. But monitoring is important, because just to say someone's doing well now doesn't mean that in 2 or 3 or 4 months they're going to continue to do well. And it might be that they need more support in the future. We don't want someone feeling guilty because after doing great in the middle of this crisis, they're now feeling that they need more. That's completely understandable. For the people who are understandably exhausted, one important thing is to make sure they're getting extra support. Prioritizing rest and relaxing activities is really important, and even encouraging your friends to do that. Adding exercise is often very helpful, and there are a number of programs that Healthy at Hopkins has. Spiritual care can be great and a very informal resource. We have so many different chaplains that are embedded on units. That is someone who is usually a tremendously helpful listening ear, who's very available where we're working. There's a daily mindfulness meditation group being offered by Dr. Netta Gould that you can access through the Office of Wellbeing website. There are support groups being offered by My Support as well as the Department of Psychiatry, where you can take a brief time to hear about what others are doing, maybe get ideas, but also get support, because we're all going through this together. And then finally, you might need more. Someone might need individual care, and reaching out to My Support is a great way to start that, where you're able to connect with the counselor, talk through what's going on, and then they can help you decide, do you need more than just that level of support? My Support is also available to family members, which is an important resource to know about. And then finally, we have the RISE team. So if there's a lot going on the unit or in the clinic where you're working, they're able to respond and be able to come and help people process what they've gone through together. Now, for the group that's concerningly vulnerable, I worry about this group. They're concerningly vulnerable because more is needed. If you have a history of anxiety or depression, it's just a fact that you're going to be more at risk of anxiety and depression returning during a time of great stress. So an assessment with the My Support clinical team might be helpful. Some might benefit from an evaluation from the mental health professional. And if someone is expressing suicidal thoughts, that is an emergency. And that's a time that you want to help get them an emergent evaluation and maybe even walk them to the emergency room. Now, obviously, different people need different things. And so we can work with someone to say, what do you think would be helpful for you? So what are the long-term consequences of being in the midst of a pandemic as healthcare workers that's gone on for a year? Well, one thing I think is that there's a level of stress and exhaustion that pretty much everyone is vulnerable. And I believe that the psychological fallout of this pandemic is going to be happening for months and maybe even years after we're through the infection risk. So when we're able to get back to a more typical way of functioning, that doesn't mean that we simply get to all feel fine. It's often when you're through a crisis that you can actually feel how hard it's been. And you allow yourself, when you don't have all that adrenaline from the crisis, you allow yourself to realize how hard it's been. So there's going to be a big adjustment also when we go back to typical practice, because we've been doing this for a year. If you do something for a year, that's the new way of doing it. And so I think all of us are going to have the recognition that we're going to need to adjust to what's coming next. So here are some final thoughts. Health professionals are really good at functioning no matter how they're feeling. So we get trained to function at a very high level, even when we're under a lot of stress. So there's a risk that we're going to explain mood and anxiety symptoms that we're feeling or that others are feeling, that they're going to explain them is just being a response to these extraordinary circumstances. And then something more serious and very treatable could be missed. We need to support each other, and we need to take action to address the exhaustion and more serious symptoms that we're going through. In addition to this introductory video, we're going to be producing a number of videos where we talk about the support and action that's available and some practical ways to think about issues of supporting each other. Thank you for your attention.